In one of my previous videos, I talked about ferritin, and now I want to talk specifically about ferritin and ADHD. What we know, there's a bunch of studies that show that children with ADHD often have lower ferritin levels than children that don't have ADHD. In part, this can be from diet, in part, this can be from utilization. And what parents often don't realize is that your child with ADHD goes through a lot more dopamine. We think about dopamine, we talk about dopamine. Your child needs more dopamine if they have ADHD. In the brain, one of the amino acids that gets converted into dopamine, so tyrosine to dopamine, goes through an enzyme called tyrosine hydroxylase. I know this is kind of getting into the weeds, but hang with me for just a moment. Tyrosine hydroxylase, which is iron dependent. If ferritin levels are low, ferritin can't give iron to tyrosine hydroxylase, which then interferes with dopamine synthesis. And when we have low dopamine, there's different areas of the brain that are affected. If our iron levels are low and we can't make as much dopamine as we want to, there's different areas in the brain related to activity, movement, attention, impulsivity can all be impacted because of the limitation on iron that then plays a role in the limitation of dopamine synthesis. And so sometimes the combination of low ferritin level, crummy sleep because of restless leg, like I talked about on my other video, and low iron levels can cause an ADHD-like presentation in children because they're not getting good sleep and their brain isn't able to make enough dopamine. We replace their iron stores, we increase their amount of iron that is available for those processes, and their behavioral symptoms improve. Now, it's not a cure-all for ADHD or anything, of course, but we can see a noticeable improvement when we improve their ferritin level. And typically when we talk about boosting their ferritin level, like we're talking about dietary, or oftentimes it's usually best supplementation when we're actually trying to make sure that it's getting absorbed and all those sorts of things, is to use iron supplementation. What we're looking for is a ferritin level around 50 nanograms per milliliter. That shows us that we've got it into a range and we can say we've got enough iron on board. Iron is not the factor that we're seeing with these behaviors. If it's lower, we can boost that up over a few weeks with iron supplementation and see how things progress from there.